And now, an exclusive sneak preview of the recent X-Talks webinar, Critical Strategies for Sponsors and CROs in 2024, Measuring Site Enablement Maturity.
For those who have not met Florence before, of course, you can check us out at florencehc.com. But we are the site enablement platform, as Sonia mentioned earlier. We have 18,000 research sites across 55 countries that use our platform to manage their electronic investigator site file, EISF. So that's all their regulatory documents, other documents they need to manage their operations digitally. We also have our e-consent platform that a majority of those sites are starting to adopt. We'll talk a little bit about trends on site adoption here in a couple minutes. But e-consent for sites. And then finally, our study organizer tool. This is a recent acquisition of a company called VersaTrial that joined Florence late last year. That is a free tool for research sites to keep all their study bookmarks, passwords, etc. in a single location so they can access that and work and collaborate with sponsors and CROs. And so if you're a research site, go check out some of those. For sponsors and CROs, we offer two key products, our SiteLink solution, which we'll talk about again at the end of the webinar, but that's where sponsors can connect into those 18,000 EISFs and also deploy EISFs to sites that don't yet have a technology solution. We're seeing rapid adoption across this technology and this platform. And then we also recently introduced integration. So if the research site's using a different vendor's EISF, the sponsor can easily connect and integrate into all those types of EISFs for 100% digital document exchange. We also have our eTMF solution, which mid-sized biotechs use to manage their in-house document workflows, which integrates directly with our SiteLink solution. And finally, we have around 3,500 sponsors and CROs that conduct remote monitoring visits on our platform on a monthly basis, and around 8.2 million research workflows per month. And so to share all that data, to say a little bit about where some of the insights will be coming from today, is we have insights into a lot of those operational data points to understand what kind of trends are going on across the globe. For those who are unfamiliar with the term Site Enablement Platform, I mentioned EISF and e-consent a second ago. This is how we define it at Florence, and how we're starting to see the industry really define it when you think about the different types of technology in clinical trials. One slide we don't have here, if you are interested, we've actually profiled around 300 plus vendors in the technology space. That's available at researchrevolution.com. Once again, that's researchrevolution.com. It's a free technology map where you can go in and see all the different technologies that map to all these areas you see on the screen here. We've profiled those vendors, what technologies they offer, some insights into their technologies, etc. But when we think about site enablement, we're specifically thinking about the technology that sites and sponsors collaborate on and work together on, and that the site could on or the sponsor could on and deploy to the site. And so Keith will share a little bit more about what those models look like in a bit. But these are some of the platforms we see within a site enablement solution: eReg, EISF, eConsent, of course, remote monitoring, eSource, site planning, feasibility selection, study organizer, inventory management, and of course the site CTMS. So with that said, a little bit of backstory of where we'll be sharing some of the insights from today. The big idea that we want to dive into to kick off this conversation is that the current approach to digitizing the connection between sites and sponsors is actually increasing the burden on sites and slowing down clinical trials. What do we mean by that? Well, sites are under increasing pressure, and if you are at a research site, this is going to ring true, but if you're at a sponsor and CRO, this is also something you are dealing with and you're seeing at your research sites. Sites are seeing more staff turnover than ever before, with 81% of sites reporting continuing or worsening turnover in the last 12 months, and this data is from 2023. 90% of clinical trial sites have their data living in more than one site system, and so they are having to keep and maintain duplicate data across different platforms. And trial complexity is increasing, with 41% of clinical trials now targeting complex therapeutics, which means that those sites have to collect more data, manage more patient visits, and really work with a more distributed trial. And so what we're starting to see and track at Florence is how this limits the capacity of research. And so if you forecast out over the next decade, how many investigators are going to be needed to fulfill the clinical trials that are expected to start based off industry data versus those that are projected to be available because of staff turnover, hiring, etc., there's around a 38% shortfall, which means by the year 2030, 38% of the clinical trials that you, sponsors, CROs, are wanting to launch will not have enough investigators to actually meet the need, much less as we start getting to the patient populations that those investigators represent. And as we dig deeper into this and start seeing how technology, people, processes all play together to dive into why those results are happening, we wanted to share some insights from our 2024 State of the Industry report.
To view the entirety of this webinar, visit the link in the description and register on xtalks.com completely free of charge.